Buenos días, mi gente de Rochester, y bienvenido a su hora informativa. Mi nombre es Ida Perez y para mí es un verdadero placer poder estar con ustedes en esta mañana. Su hora informativa es un programa que les trae información importante que esperamos que los inspire a una mejor calidad de vida para usted y su familia. Cubrimos información sobre los campos de salud, educación, empleo, vivienda y muchos otros temas más que nos afectan como persona y como pueblo. Su hora informativa está aquí todos los sábados de 10 a 11 de la mañana y nos alegramos muchísimo de que estén con nosotros en el día de hoy. Hoy tengo una invitada especial que nunca había estado aquí con nosotros y vamos a hablar de un tema que no normalmente hemos hablado anteriormente, pero es un tema muy importante. I was just saying that I have a special guest here that I'm going to have you introduce yourself, but I was also saying that we have a topic today that we haven't spoken about in the past. And that's really important. And so I'm really excited to be able to be talking about this. So if you can introduce yourself, tell us who you are, what is it that you do? And I always like to ask, where are people originally from if they're not here from Rochester, and what brought them here to Rochester?
Excellent. Thank you, Ida, for having me. I'm very excited to be here today. My name is Dr. Christine Caword. I am a comprehensive ophthalmologist with the Flaum Eye Institute at the University of Rochester. One of my many roles or hats that I wear, I'm the medical director of one of our newer satellite offices in downtown Rochester on South Clinton Avenue. It's actually a brand new comprehensive eye care center that opened up in February of 2023.
Okay.
I'm actually originally from New York City. I hail from Queens, a queen from Queens. I've been in Rochester for about 6 years now. Work brought me here to Rochester, and I just fell in love with it, and I've been here ever since.
Okay,
Yes.
okay, awesome. And where's your family originally from? Were they already in New York, or did they come from somewhere else before they got to New York?
Yeah, so my dad's side, my great-grandfather actually is from Barbados.
Okay.
My mother's side of the family is from the South, from North Carolina.
Ah, nice.
Yes.
And what brought your dad from Barbados here?
So my great-grandfather, emigrated for work opportunities, and then my grandfather, was born in New York, and my father was born in New York, and then I was born in New York. Yeah. So we've been here for a couple generations.
Yeah.
Yes.
I always like to ask that questions because, people wonder, why do people come and live in New York? Right?
God,
New York,
yes.
or why do people come and live in Rochester, right?
Yes,
Most
yes.
people in Rochester, they're like, oh, I want to go live somewhere else, and da-da-da. But then there's so many people that come here and make this place their home. But also, I like to ask that question because we often think, that our lives are so different, and they're not, right?
Correct.
Most people come to the United States either looking for work or better living, and then they tend to bring their family, and that's how, generations end up here.
Correct.
And so I always like to ask that question because often our stories are similar, and people either come for work,
Yes.
or they come because they had relatives, or they
Correct.
come chasing love.
Yes.
All of those.
Can't forget about love.
You're right. Beautiful stories that happen, right? Why
Yes.
people either end up here in the United States or end up here in Rochester.
Correct.
So tell us a little bit about this clinic, right? Because not too many people know about it, and that's why you're here today, because we
Yes.
want people to know about it. So tell us a little bit about the clinic itself.
Of course. So, again, we're on South Clinton Avenue, 500 South Clinton Avenue, Suite 104. And the history of this office is such that Flaum Eye Institute and Goodwill collaborated in 2022 to actually help improve access to the downtown community. The space that we're in historically was ABVI, which was a center that gave examinations for people with low vision or blind. And
Right.
just to kind of define that a little bit, blindness is when you have no vision and absence of vision. Low vision is when you kind of can't see that big E on the chart.
Right.
All right. So ABVI just did that. Goodwill, because of COVID, staffing challenges, was falling behind on the amount of examinations they
Right,
could provide for the
right.
community. So Flaum Eye said, you know what, let's work together so that we can improve that access for the low vision exams, but also take advantage of the rest of the space that you're not utilizing,
Right.
and turn this into a comprehensive eye care center.
Yeah.
So at this time, when we opened up, in February, we not only offer low vision examinations, but we see everyone. We see children up until the aging population.
Wow.
We have comprehensive optometry. Just basic eye needs, eyeglasses, contact lenses. I myself am a a cataract and glaucoma surgeon, so I can take care of those, more advanced conditions.
Right.
We have pediatric ophthalmology who are specialized in taking care of kids. For example, if you have a child whose eyes cross, for example, they require surgery. We do offer those services and other conditions. And we continue to provide the low vision services at our center. But the other thing that I'm really excited about, we have a full service optical shop. So a lot of people don't realize all the optical shops that are in Rochester are not located within downtown. They're kind of in this belt around the city of Rochester. You have to go to Henrietta, you have to go to Irondequoit, or you have to go to Brighton to get an optical shop. We have a full service optical shop on site. We make our own glasses.
Nice.
We service people who need contact lenses. We do fittings on site. We do everything there. We do produce our own prescriptions, but we are happy to accept prescriptions from outside eye doctors. So, anyone who would like to come down, we do offer that service. We realize the population who we're serving. We do have special pricing. So we know certain members of our community may be underinsured or uninsured. So we have something called the Gold Package, where some of our glasses will only run you about $39.
Oh, wow.
Yes.
Wow.
Yes.
That's very affordable.
So, we've been very busy since we've opened. We're growing. Adding new doctors, again, we have optometrists, surgeons, everyone there. And we're very excited to be here to serve the community.
Nice. So let's talk a little bit about vision, because we were talking earlier before the show started how people may not realize, right, that they may need glasses, right,
Correct,
or that their vision has gone a little bad. A lot of people spend their whole year, their whole life and never get a really good eye exam done, maybe a little bit at the doctors when they go for their physical or something like that, but not an actual vision exam. Tell us a little bit about that. What are some things that people should be looking for that may be like, I might need glasses.
Yeah, correct. Yeah. So we were talking with one of your associates who could really see different, signs in the studio. And, some of my patients come in and they kind of tell me about challenge that they have driving at night, for example,
especially,
right?
Yeah.
So that brings one condition to mind, cataracts. Cataracts are a condition that includes your natural lens becoming more cloudy. And I think of, like a clean window, for example, right? So that lens is your nice clean window when you're younger. As we all get older, we all develop cataracts. That clean window, that clean and clear lens becomes cloudy, so it's harder to look through, right? So it starts to affect your daily activities, again, such as driving at nighttime. Maybe you want to read something on your computer, maybe read something on your tablet. Now things are a little bit more dim for you, so that could be cataracts, or maybe you just need a pair of glasses. So, and we were discussing, like you said earlier, I think vision is just one of those senses that people take for granted. You get up in the morning and you can see what you have to do to wash your face and, drive to work. But, if that stop sign or certain signs that you were able to see before and now just look a little bit hazy, a little bit fuzzy, then I think, just how we take care of other parts of our body and go to our primary care doctor every year. You really should be going to your eye doctor every 1 to 2 years, just to check and make sure everything is okay.
Right. I know, for me, I've worn glasses just about all my life, but since a young girl. But I remember, when I first started noticing that there was some changes with my eyes, it was more with the TV. But today, TVs are so big, like everybody has a big screen TV, so even that, you can't even rely on that anymore because you got a big TV. So obviously you're going to see it a little better than if you had a smaller TV, and it wasn't until I started seeing the TV in my room, which was much, much smaller, I was like, okay, this doesn't look as clear as the one out there, right? Yes. So again, one of those things that you don't think about because everything is bigger, everything is, even our phones are bigger, everything is, it kind of makes that trick in your eye to think, oh, no, I see well. But then when you're going to go look at other things, you're like, no, I don't see too well. So things to think about, right? And keep in mind. And I know for children, like I know, for if you start seeing kids squinting their eyes, that's a sign right there that they might need glasses. I know that my one of my daughters was like, Mom, I have to sit in the front of the class because I don't see very well. So that was a sign that we needed to take her to get her eyeglasses. So things like that we should be paying attention.
Absolutely.
Right?
Absolutely.
Yeah.
So, you bring up a very good point. I think If your daughter was still sitting in the back of the class, then her grades might be affected, right?
Yeah,
So if
yeah.
and there's certain clues, that kind of, can help you think, well, does my child need glasses? To an earlier point that I made about like eye crossing and needing surgery, that sort of thing. Or sometimes that eye crossing can be treated with glasses, right? So, you just have to be mindful of that. One of the things that I also tell parents is that sometimes it comes out in the child's behavior. Like they don't know that their eyes, their vision is blurry, right? And it's very frustrating for them to not see the board, or maybe they can't see that big screen television. They can't see SpongeBob, for example, right? And everyone else is laughing. They have no idea, right? But it can be very frustrating. So you have to think about that from a behavioral standpoint as well. Maybe their vision might be blurry and it's frustrating them, but they don't know how to communicate that.
Right.
So really, the American Academy of Ophthalmology, when all children are born, they do undergo a screening at birth. But really, you should take your child to have a full eye exam at around 2 years old, 3 years old. As long as your pediatrician doesn't advise you otherwise.
Right.
But we're here. We provide those services, like I said, at our South Clinton location, at our main campus, at the university. So just some things for parents to think about.
And I know for young children, coming from the early childhood world, it's really important to get those screenings done really early on.
Correct. Yes.
Whether it's vision, hearing,
Yes.
all of those things. But vision, especially, and hearing is another one that, sometimes it comes out in challenging behaviors, right? Because the kid can't hear, and so they're pulling or they're, grabbing things because they don't, so those type of things are things that we also keep in mind and kind of keep an eye on. And, we're fortunate enough here in Rochester, we have the GROW, which is through Children's Institute, and they do a lot of screening throughout the county.
Yes.
And they're able to catch those things early on. But if they're not in a program, right, where that service is being offered, then you do want to make sure that you're talking to your pediatrician, especially if there's a history of people in your family having to use glasses, and just about every, just about all of my cousins, my dad used glasses. My dad was actually born with a lazy eye, which later got corrected when he moved here to Rochester, but he always wore glasses, and he was very well known for his dark sunglasses.
Yes.
He always wore his dark sunglasses, but that was something that we were always paying attention to because it already ran in our family. Correct. And I have cousins, that have worn glasses since they were little. So something, for families to think about if you have young children and that kind of runs in your family.
Yes.
Try to get that.
Please get
exams.
them checked out. And another service through our institute, we have what's called a vision van. And our pediatric ophthalmologist, who also works at our South Clinton location and multiple locations in the area, actually heralds, this mission where he's going out to RCSD schools, out to charter schools, Greece, and actually do visions in the school. Right.
Yeah,
so that's really another opportunity,
which is nice because you're meeting people where they are.
Meeting people where they are, and then on my way in today, we passed St. Michael's Church, and our institute has committed to be there every first Saturday,
with their outreach.
Yes, with the
awesome.
outreach. So we do vision screenings there, give out information. So the resources are there. We're just trying to, again, meet people where they are.
Yeah, perfect.
Yes.
So tell us about the 5 leading causes of vision loss.
Yes. So, the 5 leading causes of vision loss, number 1, we've touched on already, needing glasses, or the technical term is refractive error. That means, when you're either nearsighted, so you see things well up close, things far away are blurry, or the opposite, farsightedness, where everything far away is clear. When you get closer up, things are blurry. That would be number 1. Number 2 would be cataracts, and I think we touched on that, also. Just your natural lens that was clear is now cloudy. Number 3 is diabetes. So I think that some people don't realize that diabetes, or they forget that diabetes affects you from head to toe, including your eyes. So diabetes can lead to what's called diabetic retinopathy. That means that when your diabetes is not under good control, your blood sugar is too high. Your hemoglobin A1C, which is a number every diabetic should know, is too high. Then that causes bleeding in the back of your eyes called the retina. And when that bleeding happens, then the retina, that tissue swells. It causes blurry vision. And then what happens is new blood vessels are grown, and those are not as good as your original blood vessels. those bleed and the tissue swells. And it's this vicious cycle that can lead to people losing their vision, sometimes permanently, unfortunately. The next one is glaucoma. And that is a condition wherein your optic nerve, which is the nerve that connects your eyeball to your brain, that nerve starts to die because of high eye pressure. Some people use eye drops for that to treat glaucoma. The next one is macular degeneration. That has to do, again, back of the eye and the retina. The macula is the part of your retina that controls your central vision. Sometimes those cells that work to control your central vision, they just don't work as well anymore as we get older. It tends to be age-related. So those are the 5 leading causes of vision loss.
Wow. Yeah.
Yes.
And I've heard people talk about all of these, right?
Yes.
Some condition or another, especially with the diabetes.
Correct.
I've heard a lot about people losing their eyesight with,
Yes.
with diabetes. So really something to think about and make
Absolutely.
sure that you're keeping track of how things are going with you with that.
Yes,
right?
with your blood sugars. And again,
Yeah.
that, I really can't stress the hemoglobin A1C number being less than 7 is close to 6 as really you can get it, and that has a lot to do with your diet, not eating that many carbohydrates like, pastas and starches, rice. And, when you come in, when you have diabetes, when you come in, you're supposed to be coming into us to get your eyes dilated once a year.
Yeah.
Even if everything is okay.
Right.
Once a year, you need to have your eyes dilated just to check in.
Yeah. We talked a little bit about children and, why it's important for parents to take their children to get eye exams. And we talked about the importance of early screening. And,
Yes.
and if you already have a history in your family about, with eye vision. But tell us a little bit about children with disabilities, because sometimes, depending on the disability of the child, they're not able to express, they're not able to say, I can't see, or I don't see well, or, so what are some things that we should be thinking about in regards to children with disabilities?
Absolutely. So, kind of going back to an earlier point, sometimes the, that can come out in behavioral issues. So if your child, and every parent knows their child.
Yeah.
Right.
Yeah.
So, if he or she is kind of acting out, seems very frustrated, and they haven't seen an eye doctor yet, I think I would start from there just to see if there's any way for us to improve the vision, perhaps with glasses. Sometimes when children are brought in, if it's a little bit difficult for us to examine the patients in the office, sometimes we'd have to take them to the operating room. Not anything scary. We'd have to put them to sleep, make them nice and relaxed, so that we can look inside of their eyes, right? Because when you come into the doctor's office, we have to put in eye drops, which can sometimes be uncomfortable. They sting a little bit, and the child may not know what's going on. So sometimes the safest way is just to take them into the operating room, have them sedated, put to sleep. We put all those eye drops in, give them a very thorough examination, try to figure out what their refractive error, again, that's your glasses prescription if they need glasses, checking their eye pressure, looking in the back of their eyes, examining their retina, the optic nerve, the blood vessels, making sure everything is okay.
Yeah. And that's really important because, we do have a lot of kids diagnosed with some type of disability, or, we have a lot of kids diagnosed with autism.
Yes.
And those kids, you got to make sure that they're also okay, right?
Absolutely, yes.
Because they can't always express what they're feeling or
Correct.
what's happening with them. So I'm glad that you guys have ways to do that. I was going to
do,
say,
yes.
how do you do that? How do you do with a child that, just may not want to sit, or, it's hard to control them or for them to even follow directions,
Correct.
right?
Correct.
But I guess you guys have a way to
We do.
to
Yes,
do
we have
that.
that covered. They deserve the highest quality care just like everyone else. So we do. We have plans for that. Absolutely.
Cool. I know that glasses have come a long way, to how they used to be to now. I mean, you could get just about any style. You can change the styles.
Yes, you can.
They've also have become pretty affordable, where most people have two. Like I always get 2 pair of glasses because I'm clumsy, and sometimes I forget where I put them or I get them lost, and so I'm always looking for my glasses. But tell us a little bit about contacts, and because I know a lot of people, I'm not one to use contacts. Like I don't like it. It just, I don't know. It just feels funny to me. But some people love it.
They do. Oh, yeah, it's very
so what
convenient.
are some of the cares that people that are wearing contacts should be doing? Is this something that people can sleep with or keep an eye on all the time? Like, how does that work?
Sure. So, contact lenses are very, very convenient for people, right? I love glasses. I love the style. To your point, I love the glasses, but the convenience of kind of putting your contact lenses first thing in the morning and going on about your day and not having to change them or clean them or anything like that, I think is very convenient for people. But the couple of points that I want to say are that with contacts, what they are, it's a piece of plastic in your eye to help you see well. Some people sleep in their contact lenses, and I know that there are some companies out there who produce contact lenses, and they say that you can sleep in them. And if you fall asleep in them here and there, I don't think it's a big deal. However, I would not advise people to make it a habit of sleeping with your contact lenses in. Again, that's a piece of plastic on the front of your eye. When you're sleeping, you're not getting as much oxygen in your eye. It's kind of a barrier. So again, if you happen to sleep every once in a while, no big deal, but I wouldn't make it a habit every night to sleep in them. The other point I would like to make is good hygiene with contact lenses, right? Don't clean your contact lenses with tap water. You have to make sure you have the proper cleaning solution.
Right.
You have to clean the cases that you're in. I mean, it has to be very hygienic because the contact lens sits on the cornea, which is this the see-through membrane of the front part of the eye. And it's very thin. So if you don't clean your contact lenses, then your eyes are going to be prone to infection, right? Those pieces of plastic are going to carry bacteria on them. And what happens is if those bacteria infect the cornea because that tissue is so thin, then it can lead to very serious issues that can potentially lead to vision loss. So definitely, great hygiene is probably number one. And I think part of that hygiene discussion too that I have with my patients is, 8 to 10 hours. I tell them 8 to 10 hours max. And I use that number because that's about the average number of hours that we work during the day. I say when you come home, take those contact lenses out. Put in your put on your glasses. Right. We're not out your home. Relax. Right? Just relax.
Let your eyes breathe.
Let your eyes breathe. Yeah, I love that. Let your eyes breathe. Exactly. So that's one thing that I do, tell my patients 8 to 10 hours a day max. Really try not to sleep with your contact lenses, or else that can lead to some problems down the road.
I have tried them. It's just the putting in and putting out.
It's not for everyone.
It was just too much for me.
It's
I just rather just grab my glasses, put them on, and keep it moving.
And keep moving. You got it. Exactly.
And when you work with children, you're touching all sorts of stuff. So it was just too much for me. But I do see people wear them and they seem to, do very well. So I'm glad, you kind of talked about the 8 to 10 hours, and give your eyes a breather and, the importance of maintaining a sanitized area where you're working with your contacts and where you keep them and stuff like that.
Yes.
Because it can become, harmful for your eyes if you don't do it correctly.
Correct.
I know you talked about cataracts, but tell us a little bit more about that. Because I've heard of so many people, that have had cataract surgery. So what does that surgery really consist of? Like, what are you doing when you do that surgery? What should people expect from that surgery?
Yes. So I love this question, and this is the majority of the surgeries that I do on a weekly basis. So again, I told you what the cataract is inside of your eye, that clear lens has now become cloudy. What my responsibility is as your cataract surgeon is to go inside of your eye to remove that cataract and then replace it with a clear plastic lens implant. And one of the questions that I get is, doctor, do I really have to have an implant? And the answer is yes. Because light comes into your eyes and your natural lens, the job is to focus all of that light to the back of your eyes in order for you to see clearly. So I have to put in an intraocular lens implant. That lens implant actually has a prescription in it, like a pair of glasses or a pair of contact lenses. And I do, work on the size, some calculations to try to figure out what lens is right for each individual person. And even between the two eyes, it might be a little bit different. Cataract surgery, another question I get is, does it hurt? Cataract surgery does not hurt. There is no pain with cataract surgery. You might feel a pressure sensation, but pain, there is no pain. If you're feeling pain, you'll be awake enough during the surgery to let your surgeon know. I do want to comment about the anesthesia that's required. It's kind of similar to if you get a colonoscopy, for example, where you're in a nice relaxed state. I always tell people, kind of like in a twilight zone, right? You're not totally awake, but you're not totally asleep either, right? You're in and out of the the operating room in less than 45 minutes, right? So maybe out of your 24-hour day, this should take up about maybe 2 or 3 hours of your day. You do one eye at a time usually. I separate my 2 surgeries if I have to do both eyes by about 2 weeks. And then at the end, barring any complications, then your vision is improved, more light is shining in your eyes, you're able to see better, you're able to see your loved ones' faces, even more clear, the television even more clear, colors come back to people, it's so vivid, and they don't realize, again, how much they've lost when that cataract is forming until after I do the surgery. And they're seeing blues and reds and yellows more vividly.
Yeah.
Yes.
What is the care? Like once the surgery is done, what should people be doing, to make sure that everything is okay?
Absolutely. Great question. So I'll start with the restrictions. So I tell my patients, don't lift anything heavy for 7 days. And I don't have a specific weight. I just tell them, don't strain to pick up a heavy box or a suitcase. Anything you have to strain to do, let someone else do it for 7 days for you. We do provide a clear plastic shield to wear at bedtime so that you don't inadvertently rub your eyes when you're sleeping. That's very helpful. Again, you just had eye surgery. Okay. But otherwise, there really are no other restrictions. We don't change your medications. Your diet goes back to whatever it was before.
Yeah. And they're able to go back to work. And
I have patients go back to work. I think the soonest I've had a patient go back to work is 2 days, but I usually give people a whole week off. You're on eye drops. One of your responsibilities is to use your eye drops. Usually 2 or 3 eye drops to help prevent infection after surgery. Usually you'll have some level of inflammation after surgery, so you'll have at least 1 or 2 other eye drops to help control and to get rid of that.
Yeah, cool. Tell us a little bit more about the diabetes, because I know you touched based on it, but any other information that you want to give us on that? Because I think that's a real big one for me, because I know so many people that are diabetic, that later have, complications with their vision. So tell us a little bit more about that.
Yeah, sure. So, one statistic that I usually will share, is that about a third of people who have diabetes don't realize that they have diabetic retinopathy, meaning that they don't know that they have those leaky blood vessels in the back of their eyes. Hence the reason why anyone with diabetes, whether or not you're having an issue, really should be seen at least once a year in order for us to dilate your eyes. And again, the dilation drops, not everyone's favorite thing when they come to an eye doctor, a little bit inconvenient, but again, necessary. Your pupils have to open up in order for us to have a good view to the back of your eyes in order to properly examine that. And also, one thing that people may not realize is that diabetes can actually lead to glaucoma, right? So those blood vessels, those new blood vessels that I mentioned earlier, they can grow wherever they want, including the front of the eye, and they can clog your drainage system, make your eye pressure go up, and that can give you a subtype of glaucoma. So again, if you have diabetes, please adhere to your medications, whatever that may be for you. Make sure that your diet is low in carbohydrates. Make sure that your hemoglobin A1C number. I really can't stress that enough. When my patients come to me for their annual dilated eye exam for diabetes, that's one question that I always ask them. If they don't know, I just peek in the chart, let them know your A1C is this or that. But that's a number. If you're diabetic, you have to know that number. And again, for anyone who is not familiar, the hemoglobin A1C is a lab test that you're supposed to do every 3 months, just to check in to see how your blood sugar control is.
Right. So I know some people get surgery, like for example, my brother, and I don't know the name of the surgery, so you'll need to help me with this.
Of course, no problem.
He's worn glasses all his life. He just had surgery in his eyes, and he doesn't need glasses anymore. What is that?
Yes. So that is laser refractive surgery. He may have had LASIK or PRK. I think the best way for me to describe that is using a laser to reshape the cornea. So now we're going back toward the front part of the eye, part where the contact lenses rest on. The cornea is also, like the lens, is responsible for focusing that light that comes into your eye for you to see clearly. So usually, I describe to my patients that the cornea, if it was perfect, would be shaped perfectly like a baseball, like a perfect circle. But most of our corneas are more elliptical, more like a football. What the laser refractive surgery does is the laser energy is used to reshape it so it's a more perfect circle. And that way, when the light rays come in, then they're able to hit the back of the eye for people to see clearly. And again, just like your brother and others, then that alleviates you from the responsibility of you having to wear glasses to see clearly. And it's a wonderful, wonderful surgery. It's a wonderful surgery.
Do most people qualify for that? Like if you wear glasses, you can have that done and not have to wear glasses anymore?
Great question. So, you have to set up a consultation with a laser refractive surgeon, and we do have laser refractive surgeons at Flaum. So it would be something that you'd have to be evaluated for. They have to do a lot of tests, a lot of measurements, because it doesn't necessarily mean that you can get LASIK just because you wear glasses. Not everyone will be a candidate for that.
Yeah, that would be my question.
Yes,
What makes you a candidate for it?
Correct. Yes.
Yeah.
Yes.
Okay.
Yes.
Okay. Cool. Tell us a little bit about the clinic and, the services. I know you mentioned a lot of the services there, but, what about people? What, is it a certain insurance, no insurance, any kind of insurance? Like, how does that work?
Got it. So we accept most insurances. If we do have a patient who would like to be seen and they do not have insurance, then the university actually offers a financial aid program, and we do have those forms that we can have the patient fill out in order to apply for that. Yeah. Again, and in regards to our optical shop, if that person needs glasses, then we do have our gold package to address that. But we realize the community that we're serving. We realize some people have challenges. They may not have insurance or are underinsured. And we're willing to work with individuals in order for them to get the eye care that they deserve.
Good. So if people wanted to know, do you take my insurance? They can just call there and find out.
Yes, and I can give you the number to our office, 585-273-3937. Again, 585-273-3937. When you call, and if you have any questions about insurance, then that would be the main number to call. If you're interested in being seen at the South Clinton office, then let them know that that's where you like to be seen.
Yeah. Now, what about Spanish-speaking staff there? Like if someone that doesn't speak Spanish but wants to go to the Clinton office,
Sure.
What kind of services can they expect in their primary language?
Absolutely. So that's a great question. So, at this moment, I do not have any bilingual staff. However, we do have a Sericom service that is able to have us access any language, honestly, that you can think of, including Spanish.
Okay.
And through that service, we can have a video conference with the interpreter, or it could just be strictly audio. The university does have a translation service department. So if we do have someone who calls in and their primary language is Spanish, they would let the operator know that. And what would happen is we'd work with our translation service department to have someone on site that day. And they stay with you for your entire appointment. We allot extra time. We take our time. We make sure that everyone understands exactly what's going on. And that way, you have someone physically there with you. And I think, from my experience, that's patients' preferences to physically have someone there, who speaks, their primary language, can explain. And these are our medical professionals.
Right,
they're able to explain to you about hemoglobin A1C. They're able to explain what a cataract is. Right. They're able to properly translate, the risk, benefits, and alternatives of surgery. So I think if I had my way, I'd have an in-person translator for every language. But I think it really helps people be more comfortable in that space.
So you don't have someone physically there all the time, but if someone calls and needs someone to speak in their primary language, you have somewhere to tap to have someone there for that person the day of their appointment.
You got it. Yes, we do have options for our patients.
Yeah.
Yes, we want them. We know going to the doctors can be a very nerve-wracking experience. And we also realize that, if English is not your primary language, that's one of the reasons why people shy away from getting their health care, right? Because, they're very nervous about going there, not being able to communicate, with their doctor or with the staff. And we realize that. So we have, various options that we can, take into account, to help meet people where they are.
And it would be good for that person to say that as soon as they call to make an appointment.
Please
so
do.
that you guys can make those arrangements. Because what I've also seen is, people having to wait long periods of time till a translator is found. And so, you're able to avoid that if you know
Correct.
that you're coming on this day at this time,
Yes.
and you'll already have someone there for them,
Correct.
which is great.
Yes.
Are you working on trying to find some staff to
Yes, I
add
am.
to, that
Absolutely.
speak Spanish that
Yes,
are
yes,
able
and
to
on it,
help?
either if you know of anyone, the institute is hiring
Yeah.
all the time,
Good,
right?
good.
And really in studies we know that if your doctor or the staff look like
Yeah.
you, speak with you,
Yeah.
in your primary language, again
Yeah.
going back to that comfort level of patients
Yes, of
coming to the
course, of
doctor,
course.
it just makes it less of a harrowing experience. It
Yeah.
makes it less intimidating. It
Yeah.
makes it more comfortable for
Yeah.
patients. So again, the institute is always hiring,
Yeah. Yeah.
and we train on the job. I know a lot of people don't think of ophthalmology as like their number one field, but I mean it's a wonderful field.
Yeah.
Vision
Yeah.
care, eye care, it's great.
course.
You change people's
Yeah.
lives.
Yeah. Yeah, and our community is as fast as it's growing. We have to start considering people in all sorts of areas, things that we may not consider, right?
Yes.
Because there's going to be a need, especially, when people realize, okay, this is a good service, this is affordable, they take my insurance,
Yes.
that type of thing. You just never know who might walk in through your door, so you got to be ready for those things. So anyone out there that's looking and that, this is a field that you might be interested in, what we could share later,
Yeah.
how they can apply and
Yes.
things of that nature.
Yes.
I'm going to take a few minutes to kind of translate a little bit of everything that we've talked up to this point.
Yes.
And also give them the information as to where they can go and the number to call, because I think it's important that our Latino community knows, what we're talking about. So, hoy en día estamos hablando de, ¿verdad?, del cuidado de los ojos, que es algo que no hemos hablado anteriormente. Hemos hablado de muchas otras cosas, de muchos otros temas en cuestión de médicos, pero no hemos hablado del cuidado de los ojos, ¿verdad? Porque es importante hacer esos exámenes de cada año a cada 2 años y estar pendiente, ¿verdad? Si la vista de uno se está empeorando, si por casualidad de noche no estás viendo bien o de momento algo que podías ver bien claro, ahora se te ve un poquito más nublado. Los ojos es algo que tenemos que cuidarnos, especialmente esas personas que quizás sufren de diabetes, porque hemos oído de muchas personas que si sufren de diabetes y su diabetes no está bien controlada, una de las cosas que más le afecta son los ojos y mucha gente van perdiendo su vista si su diabetes no está bajo control. Tenemos una clínica que está localizada en la en la 500 North Clinton Avenue, el departamento 104. El número para llamar es el 585-273-3937. Nuevamente el número para llamar es 585-273-3937. Nuevamente en la 500 de la South Clinton Avenue, que muchas personas lo conocen como la oficina central del Goodwill y de DVVI. Ellos están ahí localizados ahora. Ellos están ofreciendo todo tipo de servicio para examen de los ojos. Pueden ser operaciones, pueden ser comprar sus lentes ahí mismo, su receta para sus lentes. Ellos dicen que cogen casi todo tipo de seguro médico. Y si una persona, por ejemplo, llama y no habla inglés y necesitan un intérprete, ellos le pueden proveer un intérprete profesional en el campo médico que le puedan explicar exactamente qué es lo que le van a hacer o qué va a suceder con el examen o si necesitan alguna cirugía. Ellos pueden conseguir una persona que hable español. Por eso no se dejen, ¿verdad?, de no ir ahí. Es una clínica bastante nueva, están buscando nuevos pacientes. Cualquier persona, ¿verdad?, que ha estado considerando ir a una clínica para examinarse los ojos, este sería un buen lugar donde ir. Nuevamente la 500 de la South Clinton Avenue en el cuarto 104 y el número para llamar es el 585-273-3937 y pueden mencionar que quieren ir a esa clínica en particular, el de la South Clinton, y si hablan español pueden pedir para un intérprete y ellos le van a proveer esa persona. Bien importante nuevamente esas personas que quizás sufren de diabetes o quizás están sintiendo, ¿verdad?, que su vista ha ido cambiando rápidamente a través de los años y que quizás necesitan un examen. Este es el lugar perfecto donde pueden ir para recibir esa información. So a little summary.
Yes.
I hope I did you some justice there
I'm
with
sure
with
you
the
did.
information that you
Yes.
shared.
Yes.
Tell us a little bit about a little more about the clinic itself and maybe some other things that folks can find there that they may need.
Got it. So, again, we're a comprehensive eye care center, meaning that we take care of everyone, children to the aging population. And again, basic needs. If you have, dry eyes or allergies, we're able to take care of that. Again, needing a higher level of service. If you have cataracts, require cataract surgery, we have 2 diagnostic suites that we can use to evaluate you for cataract surgery. We have cameras to take pictures of your eyes, front of your eyes, your back of your eyes. Glaucoma usually requires what's called a visual field to track any changes. We have that there in our diagnostic suite as well. Our low vision team is excellent. So if for some reason someone has lost some or most of their vision, we have a wonderful team there 5 days a week to offer the low vision services for our patients. And that's what our connection is with Goodwill, is that once we do that examination, then Goodwill then steps in so that they can provide for, perhaps in-home therapy or get them access to, walking sticks, what have you. So, it's just such a wonderful center, and I'm very happy to be here to, to share it with you and the community. And again, I really can't herald our optical shop. We're the only one downtown, the only optical shop in downtown Rochester. And I don't think I mentioned this before, but we make all of our glasses on premises. We're able to deliver those glasses, to patients if they can't come back to pick them up. We're able to deliver them. We have contact lenses. We have, anything that you can think about your eyes. We can definitely address it for you.
Yeah, I do want to mention in Spanish about the young children because, una de las cosas que esta clínica provee son servicios para niños hasta de 2 añitos, ¿verdad? Hasta temprana, hasta más edad. Ellos también crean sus espejuelos ahí mismo. Y ellos también pueden referir una persona, vamos a suponer que una persona, pues, ¿verdad?, que está perdiendo su vista, que quizás necesiten algunos equipos para su casa, por ejemplo, un palito, otro tipo de espejuelos diferentes que los puedan ayudar con su visión. Ellos pueden hacer un referido directamente con Goodwill y entonces Goodwill le puede proveer lo que sea necesario, lo que esa persona vaya a necesitar, which I think is really cool, right? Because it's like almost like a win-win situation there,
Yes.
being with Goodwill. And I know Goodwill well. I know, all the good services that they provide. So it's kind of cool that you can do a quick referral and they can give you, any equipment or things that you may
Yes.
need to help you with your vision, which I think is really cool. And the fact that so who really makes the glasses? Like, how does that work? Like, because you say we make them right there. So who makes the glasses?
So it's the other old job that you can do besides optometry and ophthalmology. Our opticians are wonderful. We have a great staff of seasoned opticians who physically make the glasses right there on premises. We have a lab. That
is really cool.
It's so great. And I welcome you to come to visit our office either. Really. I mean, it's such a great center. And I really can't, support and just be so proud of the team that I work with. Everyone realizes that, again, eye care really is so important, something that most people forget about, but it's so vital, right? So our opticians are superb. So they're there. They sit with you. They even help you pick out glasses, like the beautiful glasses that you're wearing today. We have a great selection, and they're not all black, skinny frames. I mean, we have colors and different shapes and different sizes. So they're experts at fitting your face shape and size with the different frames that we have. So they sit with you and select those. They sit with you, do the measurements, look at your prescription, have a conversation, go over insurance, things with you as well.
Right.
And then they make your glasses. And then if you come back in, They sit with you, fit, make sure that you are 100% happy, satisfaction guaranteed.
Yeah.
But yeah, I mean, my staff is really, really terrific.
I think it's really cool that they're making them right there.
Right there on
and
premises.
They're able to do that.
You got it.
And provide
Yes.
that. That's pretty special,
It
I think.
is very special.
When you know,
Yes.
a person like myself that have bought glasses all my life,
Yes.
you know, to know that someone is really specializing
Yes.
on your face, your,
100%.
you know, the way that you are, the things that you
That's
like.
right. It's
you know, to be able to cater that directly to my likings is pretty cool.
correct. Yeah, we're really striving for that kind of boutique feel experience, right?
Yeah.
That you're that one-on-one,
Yeah.
and the person who you're talking to is actually going to be the person making what you're going to be wearing on your face,
which is pretty
right?
cool.
Which is great.
Yeah.
But you know, we really strive to have superb service for our patients. So
Nice.
definitely something that we're proud of.
Nice. Ella estaba compartiendo de que ellos tienen personas ahí que actualmente hacen los espejuelos. Ellos te miden, te hablan, te explican, te preguntan cómo exactamente tú quieres esos espejuelos y ellos lo hacen ¿verdad? Como tú lo quieres, y yo creo que eso es bien especial porque no todos los lugares lo hacen de esa manera. Tú tienen varios espejuelos y tú escoges de los que ya tienen, pero ellos pueden hacerlo exactamente para la medida de tu cara, como a ti te guste, el estilo que te guste, lo cual para mí es muy especial. Yeah, I think that's really, really cool and pretty special. You know, tell us again what people should be doing on a regular basis when it comes to their eye care, because I know, you know, we should be going so many times a year, you know, and I think you also mentioned something that I thought was really important, you know, when you were talking about, I think it was the glaucoma, you know, to have a record of what your eyes look like. And I think that's really important. Like we do that for our breasts, right? We do that for a lot of other things, but we don't think about that when it comes to our eyes.
Yes.
If you are going to the doctors regularly, then they're going to have some records of what your eyes were and where your eyes are now today, and then kind of help you along the way.
Yes.
So tell us about, you know, how often should people be going, and what's the age to start, you know, taking either your child or you know, to get your eyes examined, and why it's important to do that on a regular basis.
Correct. So I'll start with the children, with the babies. You know, 2 to 3 years old. You know, make sure that you get an eye exam. You know, with the pediatric optometrist or pediatric ophthalmologist. You know, kind of fast forwarding, anyone who doesn't have any serious eye conditions, they just wear glasses, you know, really checking in every 1 to 2 years, I think would be optimal. You know, once your age starts getting closer to 40, after 40, you may want to start going each and every year, just because some of those conditions that I talked about, cataracts or glaucoma may start to be developing, you know, so every year after the age of 40. But again, if you have some eye conditions that require you to go a little bit more, then your optometrist or your ophthalmologist will let you know about that. You know, some of my patients who have glaucoma, you know, I'll see them 2 or 3 times a year, right? So, you know, for every patient, we just have to figure out what is the right regimen for you, so that we can check in. Again, you made the point, just like your breast, the rest of your body, right? You're supposed to go in to get your mammograms, you know, every so often. Your primary care doctor, you should be checking in, you know, every year or two. So think about your eyes the same way.
Yeah. That was, when you said that was the first thing that came to mind.
Yes.
You know, because I know with breast cancer, if you start doing those exams, you know, those screenings very early on, they can compare, right, and see right away if there's any changes and catch things on time.
Yes.
You know, that you may not, you know, have to go through anything because you're going to be able to catch that on time. I'm thinking the eye the same way. If you're constantly going, you know, to get your eyes examined, then they're going to see if there's, you know, a difference, if something's going on. Hopefully they can catch it early on, right, where you don't have to have surgery or maybe something else going on. So we got to think of our eyes the same way.
We do, And in our community, you know, sometimes those barriers to healthcare, you know, dictate, you know, and people don't get there early enough. We don't catch those conditions early enough. So then when you finally do get over that hurdle, get into the doctor's office, then now you have advanced this or end stage that.
Always.
Right. So that's why I'm so proud of the center, you know, on South Clinton, is because we're here, you know, the location matters. We're on 3 bus lines. We're near the 490, you know, we're, you know, on South Clinton. I mean, it's, you know, the parking is ample and it's free. So, you know, one of my missions really is to make sure everyone in our community gets their eyes checked
Yeah.
at least one time,
Yeah.
so that we know exactly what's going on, making sure everything is fine. If there is anything, then hopefully we catch it early.
Right.
Hopefully
Right.
catch it early.
Definitely,
Yes.
especially the little ones, because
Yes.
I've seen kids as young as 1 with glasses already.
Correct. Yes.
And so, we can't take that for granted, and
cannot.
making sure that those eyes are well, because if, anything which, with anyone, right? But in children in particular, because they're still learning, anything that may not be functioning well is going to hinder them
Yes.
from learning well, from doing well in
Exactly.
school, creating those social skills, all those things that are really
Correct.
important for children. So, don't forget the little ones
Don't
too.
forget the babies.
Don't forget the
the
babies.
babies. Yeah, that's the foundation.
Yeah.
And sometimes it's unfortunate. I will see adults who don't have very good vision in one eye, because when they were younger, they didn't have access to the glasses.
Yeah.
So what happens is, between your eye and your brain when you're young, those neural connections are formed, right? And that vision is developed. You want to have healthy vision established when you're young.
Yeah.
Because again, to your point, when you get older, if that did not happen at the foundation level,
Yes.
it can affect you.
Right.
It can affect you for the rest of your life, unfortunately.
Exactly. Yeah.
Yes.
Yeah. So tell us again where people can go.
Yes.
I want you to tell us where people can go for an eye exam, but I also want you to tell us where people can go if they're interested in working in your clinic.
Correct.
If they have any interest in that.
Yes, of course. So again, our South Clinton satellite office location is located at 500 South Clinton Avenue, Suite 104. And our telephone number is 585-273-3937. That phone number again is 585-273-3937. And if you're interested in being seen at our South Clinton location, just let our call center know that you're interested in being seen at that specific office. As far as job opportunities go, you can go on our University of Rochester Flaum Eye website, and under job opportunities, and every job that we have listed in the institute will be on that website.
Yeah.
Yes.
Yeah. What would you say to maybe some young people that may be listening that never really considered being an eye doctor? Like, what would you say to those students, and how would you encourage them to maybe think about it?
Absolutely, yes. I want everyone to be an ophthalmologist. I'm a little bit biased, like become a surgeon, but that may not be what everyone wants to be.
Right.
I think vision scientist is again a wonderful subject and topic. Eye care. There are so many jobs that you can do within this field. So again, I'm an ophthalmologist. I work with my optometrist. I work with my opticians, again, the people who make our glasses, my ophthalmic technicians. I have, 2 really fabulous people who work with me, on a daily basis, take care of the patients. I have my front desk staff, my office manager, but I think, for young individuals, keep an open mind. If you don't know that much about eye care, I mentor, I have, kids come and shadow me. I have,
Nice.
a high school mentee who's come to my office just to follow me around for half a day so that they can see and understand what I do.
Yeah.
I have medical students who I mentor, and they come and shadow me, in the office and also in the operating room to come in and see what I do. And that reminds me, in the operating room, I don't do that surgery by myself, right? So we have, ophthalmic nurses who work in the operating room. We have our scrub technicians, our surgical technologists who are responsible for taking care of and handing over the instruments when I need them. So I think that the opportunities are just numerous.
Yeah,
They're numerous,
endless,
But if you're curious, there's so many opportunities within the institute. For students to get involved in. We have summer programs. One of my colleagues, Dr. Karen Allison, actually started a summer program last summer for some high school students to come in and be exposed to ophthalmology and eye care. They were able to go to the operating room. They were even able to, kind of talk to the anesthesiologist while they're there. Because again, I think in our community, we are still underrepresented, in the healthcare field. And if you are interested, the university is really here for you to tickle your fancy. Just come on in, try to, try it out. You know, I think honestly, if you have a passion for healthcare, there's something there for everyone.
Yeah, definitely. You know, and I've seen a lot of Latino dentists, but I haven't seen a lot of Latino eye doctors.
Yeah. So, you know,
Something to think
it's
about.
something to think about. I mean, you know,
Yes.
for ophthalmologists of African descent, honestly, at this point, there's, you know, in the United States, it's only 3% of us.
Oh, wow.
And I think if you're of Latin descent, if I can remember correctly, it's about 1 to 2%. So it's less than 3%.
Yeah.
So there's not. So, you know, that's why we create these opportunities for our
Yeah.
students to be exposed, you know, to eye care, to
Yeah.
ophthalmology, to optometry, so that they can help take care of us when we get older.
Right, exactly.
It's so
Yeah.
important. It's so important.
Yeah. And like you said, you know, having someone that looks like you, that talks like you, that
Correct.
understands,
Huge.
you know, especially when it comes to things like diabetes and things, because that has so much to do with how we eat, right? Our
Yes.
diet. And so
Yes.
someone that can understand that and say,
Yes.
listen, I know that we love to eat this and this and this, but, you know, maybe you can try this instead or less of that or whatever, you know, to be able to have that background is so
Absolutely.
important, right?
Yes.
But kudos to you guys. You know, thank you for being with us today and bringing all of this
pleasure.
great information. You know, and hopefully there'll be some students out there that may be thinking, I really haven't thought about what I really want to do, but
Yeah.
maybe this is a field I should look into.
And check out our website. You know,
Yeah.
for Flaum Eye Institute, we all everything, job opportunities, any internships.
Yeah.
You know, we have all that.
I
listed
love
on
the
our-
fact
on
that
our
you have
website.
like a summer program and that you're
Correct.
tapping into high school students, because that's really where, you know, sometimes students just don't know exactly what they want to do.
Correct.
And to be able to just have an idea of what that could be like,
Yes.
and, you know, seeing, kind of picturing themselves being able to do that,
Yes.
you know, might help them go into that direction. And I would love to see more than 1%
Yeah.
of Latinos
Me
in this
too.
field,
Yes,
for sure.
absolutely. Me too.
Yeah. So I like to close the show by asking if there's a phrase or a saying that you grew up with that still resonates with you today, and do you have one?
I do,
Okay.
Ida. So it's just something that kind of rings true. I heard it maybe in my teenage years, exercising. I think from one of my fitness instructors, and they said to treat your body like it belongs to someone you love. Treat your body like it belongs to someone you love. Hopefully, everyone has that self-love and they're taking care of themselves. You know, but again, maybe just think of others. Think of your kids. Think of, you know, someone who you really love and you want the best for them.
Right.
Right. I want the best for everyone. Hopefully they want the best for themselves. I want the best eye care for everyone.
Yes.
And everyone deserves to have that best eye care.
Right. Yeah, awesome. And anyone that's listening, if you haven't had an eye exam lately, make sure you go down to
Yes, we'll see you in South Clinton.
and South Clinton Avenue for your appointment, because it's definitely important.
Very.
Thank you again for
Thank
being
you,
with
Ida.
us today. We really appreciate it.
I appreciate your time. Thank you so
Gracias
much.
a todos por acompañarnos en esta mañana. Lo esperamos nuevamente el próximo sábado de 10 a 11 de la mañana en Poder 97.1 FM, la única estación radial latina con dueños y operados por latinos, por la comunidad, para la comunidad. Esto ha sido su hora informativa, trayendo la información importante que nos inspira a una mejor calidad de vida. Que pasen una linda semana. Hasta la próxima, mi gente.